Good morning. Greetings from Marissa. We're here for a few days. We're with the believers here, and it's a real joy. They have such pure hearts. They have like a fervency for God and serving continually in the gospel, teaching in the orphan home. So much work they do. We thank God for it. So I wanted to talk about an article that was written last year by Dr. Vivek Murtha. He is the Surgeon General of the United States, the head doctor of the United States, and representing the government. He wrote in his article and he said, the defining public health crisis of our time is the mental health of young people. And he said, I issued this warning because of its urgency. And he said 95% of teenagers, 13 to 17, use social media. And from 8 years old to 12, 40% of them. So he acknowledges the benefits. Social media has some good benefits. But he says the dangers of it are huge. And he says, it contributes to anxiety, depression, lower self-esteem, especially among children and teens. And then excessive use kind of can affect sleep, socialization, like the amount of people who go to bed with their phone in their hand and wake up and the first thing they reach is their phone and go into it. The numbers, not only with teens, but with all people. So, like he says, the platforms have the best minds, the best talents in the world to keep as many people as possible on them for as long as possible. That's their business model. It's very good from a business point of view. From a mental health point of view of people, it's not very good. And so, like a couple of points on it, we're all very aware of it. But I just want to make a couple of points on it. And the main thing I want to talk about is that uh, the inability to kind of be able to form your own views is a danger in it. Like to be constantly putting things out into public, and also the time to be able to sit quiet and form views. Like, for example, if you get your views, if you're in a good community of people in a church and you have a good community of people and your parents and you believe the same things, you hold the same sort of beliefs about the Bible, about morality, about heaven, about Jesus Christ, and you hold those same beliefs and many other values you hold together, and you get them from your peer group and community, that is wonderful. However, when you move into another community, say you go to college or say you go into the workplace in a huge office space, now your community of people believes different things, and it's very easy to absorb that because it's not welling up from within us. And what we think we have only gotten from kind of the peer group, but it hasn't taken root in us. And that ability for things to take root in us um, is needs time, and needs time to be able to be before God and soak before God. They used to talk about a term called the quiet time. People would say, I have a quiet time every day with God. I have my personal devotion, which kind of meant that in the morning they would set aside 10 minutes, 20 minutes, some people 30 minutes, whatever time it would grow with people. And they would basically just sit quiet before God, read a small part of the Bible, and then they would just sit quiet before God and think about their day, and sometimes let their own thoughts rise to the surface, and or God speak to them, whatever way you want to say that. And but that time where they would soak with God, things kind of took root in them, and it was a regular practice of kind of Christian life. And so I read this little story of which you probably heard different things similar to it. It was about people who went and they did this little survey, and they wanted to test peer pressure. And so what they did was they got whatever number of people, 10 people or so in a room. Now, can we see that, the lines there? And they show the lines. Now, I've made it very obvious here just because of the camera and that. But so they show these three lines to people, and then they said they had whatever number 10 in the room, and says, which is the longest and which is the shortest. So 95% of them, are a huge number of them, got almost all got the answer right. So what they then did was they got some actors, and they put two actors in the room, and the actors would very confidently say, the middle line is the longest. Now, it wasn't as obvious as that, as I said, but it was quite obvious. You could tell, like, they were all getting it correct. The middle line is the longest. So the two actors very confidently said that. So then the others didn't want to feel left out. I can't remember the ratios of how many actors and real people. So then the numbers dropped, and the amount of people who were more sure that the long line, the top line was the longest, dropped. So what they did was, because this brain scanning imagery is so advanced now, what they did was they tested it with the brain scans. They wanted to see, is it the peer pressure? And they just say, I know for sure that the top one is longer, but I want to fit in, so I'm going to say the middle one. Or did they actually believe that the middle one was longer? So they did the brain scans, and it goes something like this, that a certain part of the brain is active when your socialization part is most active, and another part when your perception is most active. And it turned out that it was your perception was most active, and that the group changed the perception of the people. It wasn't that I actually believe that the middle one is longer, but the top one is longer, but I'm going to say the middle one because I want to fit in. They actually, then the perception changed, and they started to think that the second longest one was the longest. So the point of it is, that kind of research was that your peer pressure changes what you think of things. You see things differently. It's not that I'm going to leave aside what I really believe and believe this instead, is that I actually believe now that this is right. It changes our perception and things. It's just an interesting little survey they've done, and with using both the survey and then the brain scanning. So just I want to finish with that. This Dr. Vivek Murtha saying the defining public health crisis of our time is social media. And one of the aspects of social media is that it is taking away that ability to be before God and to have in your heart your own beliefs, because they must be formed personally. We thank God for the shaping of community and the shaping of those of family, how they shape us. But for these things to take root in us, we have to, and so that we own them. They're my beliefs, my values, my convictions, and I am not formed and squeezed by the pressures around me, even when they're good pressures, because the huge amount of people in the United States, and it will possibly be a growing number in India and other parts of the world, who grow up in Christian homes and have good solid beliefs, but then they move to a college campus that are not believers, and they fall away from the faith because it never had root in them. It was always held together by the outside influences, and now when they have other outside influences, they are shaped by those, and it was not welling up from within them. So amen. Have a good day. God bless you.